everyone, nice to meet you here. During today's short lecture, I will briefly explain about the nasogastric tube, which in the short term is the NGT. Firstly, what is nasogastric tube? Nasogastric tube is a soft and thin tube which is inserted by the nurse into patient's nose, and then from the nose, this tube will then further go down into the esophagus, which is your food pipe, and then finally reach the stomach. So why the patient need NGT? Now this tube is used for the nurse to provide feeding to the patient continuously to help patient to receive nutritional support. Now what kind of patients need this nasogastric tube? Now for patients who suffer from terminal illnesses, especially cancer, or for the patients who are too old to tolerate food orally. Now because these patients are too weak, they could not swallow food or drink through their mouths, so they need to be fed through the other way. That's why we insert this nasogastric tube through their nose and then directly into their stomach to help the patient to receive continuous feeding. Now, the NGT is normally made from two materials, including polyurethane or silicone. It is very soft and thin. Now, it has mainly three types: Levan-catheter, Salem, some-catheter, and Dophoff tube. Now, Levan-catheter and Dophoff tube, they are normally called the small bore or fine bore NGT. That means this NGT is thin with smaller lumen, smaller opening. Now the small bore NGT, because it's thin, so it's normally preferred to be used for long-term internal feeding because it causes less discomfort and less irritation to the stomach. So small bore NGT is normally used for long-term medication administration and nutritional feeding. Now, the Salem some-catheter is also called a large bore NGT. Now, large bore NGT is normally thicker with a larger lumen, larger opening. Now, the large bore NGT is normally used to aspirate the stomach content to be tested, or for the patient who ingested the poisoning into the stomach. So we have to aspirate the poisoning stuff from the stomach quickly to treat the poisoning. So in this case, large bore NGT is normally used to aspirate the stomach content to remove the things from the stomach or to collect the sample to be tested. So that's normally usage. Now, how do we insert the NGT for the patient? So as a nurse, when we insert NGT, so before we insert, we have to measure the length. So how long we have to insert this tube. So when we measure the length, now we put the tip of the tube, put the tip of the tube to the bridge of your nose, and then from the bridge of your nose, you measure to the earlobe and then down to the xiphoid process, which is end of your sternum, and then you use a tape to mark the position so you know how long you're going to insert this tube. Now, when we insert the tube, now because it is a very uncomfortable procedure, so patient could feel very uncomfortable. Now, so when you insert, firstly you have to observe the nostril. Make sure you choose the nostril which has no blockage. And also when you insert, you have to be very gentle, and after you have to apply the jelly or the lubricant at the end of the tube to lubricate the tube to reduce the discomfort. And then when you insert through the nose, you're going to reach back of the throat, which is called the pharynx, nasal pharynx. And so when you insert the tube, you will then feel a resistance. After you feel the resistance, you need to tell the patient to swallow down the tube, so the tube can go to the esophagus. Now, when you insert the tube, if the patient starts to cough, you have to immediately stop, because that means the tube could go to the wrong way, because the airway and the esophagus, they are too close to each other. So when patients start to cough, it could mean that your tube is going into the airway instead of the food pipe. So you have to make sure patients sit in a straight and nice position, and when you insert, make sure patient doesn't cough. And after you feel the resistance, tell the patient to swallow down the tube, and then until you reach that point which you marked, then it's done the procedure, and then you secure the tube to the nose with the tape as well. So how to confirm whether the tube is inside the stomach or not? The most common way we use is to use a syringe to aspirate a little bit content from the tube, and to use a pH paper to test the pH. Now we know that the stomach content, the pH, the acid inside the stomach is very acidic. It's normally, the pH is normally between 1.5 to 3.5. So when you remove a little bit fluid from the tube, you use a pH paper to test the pH, and the pH should be below 4. If it's above 4, that means the tube could be in the wrong location, and then you need to refer this patient to an X-ray to accurately detect the location. So that's some basic information about the nasogastric tube. So I hope you could have a little bit more understanding. Thank you.